Good morning, good afternoon, everybody. Thank you for having me. It's lovely to be here. I'm Melanie, so I'm a psychotherapist, recently graduated, so I like to think I'm on the cutting edge of the current sort of science and all of the world that is psychotherapy. I've also been at the British Heart Foundation for almost 4 years, and my role there is primarily engagement with supporters and also fundraising for life-saving and life-changing research. So that's what we do there. I'm not sure I would call myself an expert. I'm certainly not a nurse or a doctor or any sort of that sort of level, but I do spend a lot of my time talking about heart health. I do spend a lot of my time directing people to the British Heart Foundation website, which is full of information about heart health. Every heart condition you can imagine, treatments and cures and research is all available there. That's a really useful resource from the off for everybody. But if you didn't know, heart disease is currently the biggest killer of human beings worldwide. Certainly here in the UK, it's the biggest killer of men. And it takes the lives of twice as many women as breast cancer. In the UK, every 16 minutes, a woman is admitted to hospital with a heart attack. So it's not very well known that it's a common thing for women. And so we're trying to change that. We're trying to spread more awareness. I do lots of talks for women about heart health and empowering them to understand their heart health, but worldwide, heart disease is the biggest killer of men and women. So we need to do more. The British Heart Foundation fund over half of all research into heart and circulatory diseases, and that cascades out into Europe and out to the States. Maybe 60 years ago, 7 out of 10 people didn't survive a heart attack, and today 7 out of 10 people do survive a heart attack. But a woman wasn't being admitted to hospital every 16 minutes 60 years ago either. So some things have got a lot better and some things feel like they've got progressively worse. In terms of women and heart health, there's also a big gender bias, and lots of women get misdiagnosed when they're having a heart attack. We did a piece of research at the BHF over 10 years, and we found, and this is a shocker of a statistic, we found that 8,200 women died unnecessarily because they were misdiagnosed at the point of having a heart attack, which is just absolutely dreadful. 8,200 women. I'm not a nurse or a scientist, but what we know is that when men have a heart attack, they tend to emit a chemical called troponin, and we were medically testing women for that same component to clarify whether they were having a heart attack or not. So women would be in hospital presenting with heart attack symptoms and be sent home. So that's the misdiagnosis part. So we are getting better at that. But there is still a gender bias in researchers that aren't women, scientists that aren't women, test subjects and clinical trials that don't involve women. And I think that's the medical model generally across the world. We are getting better at it, but it's definitely one of the reasons that we see that misdiagnosis and that gender bias. Heart health is something I'm really passionate about, and my stance as a psychotherapist and perhaps from a heart health perspective is that I don't believe that the mind and body are separate. I think that it's one thing that works collaboratively. So what's happening in the mind is impacting what's happening in the body, and what's happening in the body is impacting what's happening in the mind. We know about development and developmental challenges that alcohol can present in the body, but in terms of heart health, I think the biggest challenge that we have with consistently consuming alcohol is that it can raise your blood pressure. And raised blood pressure over a significant amount of time is what will inevitably, eventually, potentially lead to a heart attack. Sitting in a high blood pressure position for a sustained amount of time is just the worst thing for our hearts. And alcohol is one of those things that increases our blood pressure. It's really easy to get a blood pressure monitor. Lots of people have Apple Watches that monitor their kind of heart rate and stuff, but if you know what your numbers are or your numbers should be, it's a really good idea to have a blood pressure monitor at home and just check your blood pressure a couple of times a week or every day if you're not feeling well. The very first indicator that something is wrong with your heart is a too high or a too low blood pressure. Smoking is obviously another big one. We know that smoking furs up arteries and then blood can't pass properly through arteries, and that can cause a heart attack as well. There's a misconception that somewhere someone said that a glass of red wine is good for your heart. I don't think anywhere a researcher has probably ever said that a glass of red wine is good for your heart. I think what they've maybe said is that red wine can contain antioxidants, which are good for your blood and your heart. But actually, a punnet of blueberries would be a much better choice than the glass of red wine. It's a bit of a myth, that one, or an old wives' tale, I think. But yes, so that's and for all the ladies on the call, in terms of heart health, I'd really take the opportunity to say to you all, if you don't feel right and you feel that something is amiss, please check it out. As women, we're very quick to fob off our symptoms as being, I've done too much, or I'm tired, or I've got a bit of indigestion, or I've just eaten something that has made me feel a bit strange. Pay attention to your body. That is a really vital thing for you all to know. I sadly have met people that have ignored symptoms and it hasn't ended well. So know your body, know your blood pressure, and understand what it feels like to feel normal, and that when something is amiss, that it's worth getting that checked out. We're all individual, and that's why I'm saying to you, if something is amiss for you and doesn't feel right, then please pay attention to that. Generally, with a heart attack, we tend to see people can be breathless, they can be sweating, they can be holding their arm, they can feel like they've got indigestion, they may just feel a little bit off. In women, there was a recent piece of research that came out that said 6 months before having a heart attack, one of the most presenting symptoms that women had was actually nausea. So just generally feeling sick and not really knowing why. A lady had said to her friend that she had been making the bed and felt really out of breath and never thought anything of it, just thought that maybe she had done too much or was getting a cold or a virus, and she ended up having a heart attack as well. It can present differently in lots of people, but generally you might notice a pain in your arm, you might be sweating, you might have an increased heart rate. One of the very popular ones is indigestion, and lots of people will fob off, oh, I think it's just indigestion. I don't want to scare anybody, but we have a lady in the East Midlands, a doctor, and she was on the phone to her friend and on hands-free in her car, and she said, I think I'm having a heart attack. Her friend said, oh my goodness, pull over and call an ambulance. So she pulled over and called an ambulance. When the ambulance arrived, they pulled up behind her and looked at her and said, oh, I think you're okay. Can you just walk to the ambulance and we'll run some tests? So she got out of her car, walked to the ambulance. They ran some tests and said, we don't think you're having a heart attack, but actually probably just take yourself to A&E and get it properly checked out. So off she took herself to A&E, where she waited for 8 to 10 hours. In that time, she had a small heart attack. And when you have a heart attack, the part of your heart that is blocked, or where the attack is, that part of your heart then grays out and it almost doesn't work anymore. So people end up living with heart failure. So she's now a lady living with heart failure because she was misdiagnosed at that point. So again, they looked at her and thought, this isn't coming up on this register. She looks okay. We're going to send her to A&E on her own. I guess that kind of shows the variety of symptoms. Somebody could collapse holding their chest, and somebody could be driving their car and feeling just a bit off. So my advice to everybody would be to monitor it and to have it checked, because I think the one thing about our hearts is we can't see them. So we don't know what's happening in there. And quite often when something goes wrong, it can go really wrong. So keeping our hearts healthy is huge. There's lots of things we can do. Healthy diet, gentle exercise, even just walking, and limiting our intake of alcohol, cigarettes, all those kind of things. I caveat that because some people live the healthiest lifestyle in the world and might have a genetic undiagnosed heart condition. So you can't completely eliminate your chances of being unwell, but it's definitely going to help you to limit the things that are going to cause high blood pressure, and stopping your intake of alcohol. Absolutely. That's going to be a great one. .org.uk. If you type in women and heart health, heart attacks, alcohol and heart health, any of those things, there will be a myriad of information that you can access for free on there, that will be really informative and useful.
Okay, thanks, Mel. As she's given us permission, talk to us a little bit about Helen, just about how you knew her before, during, and after the drinking, and how she's changed. Because we've all known her for just over a year, but you've known her for 20.
Helen is the reason that I'm here with you guys, because I believe in Tribe Sober and in this process and in this group and in this way of being. As a psychotherapist, again, I believe that human beings are built for connection and relationship. And I think that what you have here, this literal tribe, is phenomenal. Having been with Helen for 20 years, I think we probably did what everybody does when you're young. We go out drinking, dancing. And Helen always used to say to me, when we first started to unpick this, that she always used to have a switch where she would have had enough, where she could stop and she knew that she'd had enough. I don't know if she's ever said this, but she always used to say her teeth used to go squeaky. I still don't know what that means, but she said that would be her sign that she'd had enough. Her teeth would be squeaky. Then progressively, I'm not sure how or when it started, but I can say certainly maybe the last 6 or 7 years have been really tough for Helen. As a friend, it's hard because I'm not her therapist, but I have been on the journey with her and I've seen lots of life events that have challenged Helen, and I can't not associate that with her increase in her drinking. It got really bad and I was really worried about her. Before she found you wonderful lot, I actually had a bit of an intervention and I picked her up and I drove her to an AA meeting, and I remember it was awful. I remember her sitting in the car sobbing and I said, come on, we've got to go in. I don't know what else to do to help you. I felt powerless. I felt like I just couldn't do anything to help her. So I walked into this meeting and as we know, it wasn't the right path for Helen, as I'm sure it isn't for everybody. But at that moment, I feel like we had started down a road of accepting that something needed to change. And that was maybe, 5 years ago. In this last year, since Helen found Janet and Tribe Sober in this community last February, I cannot believe the transformation in her. Somewhere in the middle of the last 10 years, I watched her fade away and disappear, and I lost her. Even though we were still communicating, and she was never fully present in herself or with me or with our group of friends. And in this last year, I've seen her come bounding back. She is bounding back. The weight loss and everything is a byproduct of it, perhaps, but her confidence, she's traveling the world, visiting some of the people on this call. This is a girl that 2 years ago could not leave her house and would not leave her house because the wine witch would take over her at 3 o'clock in the afternoon and she physically couldn't leave the house. She couldn't drive anywhere. And now she's traveling all over the world, visiting people in Tribe Sober, and she's cheerleading and championing this program. Yeah, as a therapist, it's very interesting for me to watch that because it really feels like the isolation and just the dark place that she was in. She needed people that were there as well. I've seen her talk about the WhatsApp group and the fact that you guys are all in different parts of the world. So there's always somebody online, and her sober twin. It's just an incredible thing. It's an incredible thing. I can't tell you what it means to see her thriving again. It's an awful thing to feel powerless and accept that there's nothing you can do, but this community has pulled Helen through, and now she's absolutely passionate about helping everybody else, which I think is why I've ended up here. Her journey has been amazing. So yeah, so that's how I know Helen. And yeah, we've come full circle. And actually, we've come full circle and some, because now we go out and we drink mocktails, and alcohol isn't the pinnacle focus of our socializing events anymore. Helen's horse riding again, and she's playing walking football, and there's no stopping her. So yeah, it's quite something, and I'm forever grateful, Janet, to you and to the group of ladies that are going to live on Butterfly Lane, or whatever it is that they call it in the future. It just proves to me that human beings need connection, and we need connection with people that really know and understand our experiences, and this is a great place for that.
Yeah. Oh, thanks, Mel. Just talk to us a little bit about psychotherapy, because you consult online, so any of us could have a session with you. So just talk to us a bit about what it is and how it's different from coaching, because I think by now we're all more familiar with coaching, and I'm a qualified coach and Lynette's here, and we know all about coaching, but we're not quite so clued up about psychotherapy.
Absolutely, yes. So last year I met an incredible coach at an event. He was speaking about coaching, and I absolutely love coaching as well. I've had some coaching myself, but he was sharing his journey, and I guess this is the easiest definition for me in terms of the difference between coaching and psychotherapy. He said that as a coach, we're very goal orientated, we're looking forwards, we're driving forwards, and we're looking to do that. But sometimes to be able to go forwards, we have to go backwards. And psychotherapy and counselling is very much, particularly the way I work relationally, is very much looking at our past and our history and our earliest moments in life and our relationships. And I really love to use the analogy of an arrow. So if you take an arrow and a bow, the arrow has to be pulled back to be able to propel forwards. An arrow won't solely go forwards on its own. And I like to think sometimes that's really useful to think of it that way, that sometimes we need to unpick some of the stuff in the past to allow the arrow to fly forward. Most people come to counselling and psychotherapy when they feel that something is off, that they're at conflict with either their job or their relationship or themselves. It might be that they have been using alcohol or drugs to escape, to numb whatever is going on. It's a wonderful and incredible thing because it can go anywhere. We can start somewhere and end up somewhere completely different by the end of 50 minutes. We talk about trauma, and this is a bit of a gross analogy, but you'll learn that I love an analogy. So the arrow is the first one. My thought is that if you have a wound, let's imagine it's like a cut on your arm or something like that, and it's really deep, and you clean it out and you pop a plaster on the top of it and you carry on with your life, and the plaster does the healing and you think nothing more of it. But somewhere in that wound, there's part of it that wasn't quite cleaned out properly, that didn't quite get what it needed. So the wound, that little bit will fester and it will eventually reopen. Psychotherapy for me is a little bit like that. It's a little bit like digging into the root cause, the very root cause of what it is that is unsettling us. Quite often, what people present with in a therapy session in the here and now is very much related to something that might have happened 10, 20, 30, 40 years ago, but has been unresolved on some levels. It's a phenomenal process. I've done it myself. I've had 3 years of personal therapy as part of my degree, so I know where I'm asking people to go. It is not always easy. Sometimes gets a little bit worse before it gets better. It takes resilience and it takes bravery. But I genuinely believe in the process, and I think at the end and the other side of that is liberation and freedom from all sorts of emotions, and also lots of personal growth and development. And the relationship is very unique between a therapist and a client, and it's a wonderful space, and quite incredible things happen there.
Thanks, Mel. Your website, please, so that people can contact you.
Yes, it's .lincolnshirepsychotherapy.co.uk. I can do sessions online as well. But yeah, I'm happy if anybody is interested in exploring therapy to do a 10 or 15-minute call and see if it's for you, see if we could work together. But you have to be in a place where you want to do it and you're ready. And I think the timing is everything, but it really has to come from a want to dig into the stuff that is being masked by perhaps, or in the past, maybe through alcohol or drugs or whatever. And there's a quote that I've written down. I read this in a book yesterday and I thought it was really poignant. And it said, "The thing that makes life tolerable is simultaneously destroying it." I thought that was really powerful because, particularly in relation to drinking, I've met people that the drink is enabling them to tolerate their life or their emotions or their current situation. But simultaneously down the line, if we think back to heart health and mental health, it's also destroying it.